And the following Q&A session will be a little different, as questions for the panelists will be asked by Mayor Dan Pope, as our media partners are already aware of this. We'll return to our traditional news conference format on Monday, the 21st at 11:30. Leaders from the local faith community will join us on our panel that day. So let's get started tonight with Lubbock Mayor Dan Pope.
Thanks, Lacey. Good evening, everyone. It's good to be with you tonight. We're in a different time slot, and we've got some really exciting presenters tonight. I think you'll enjoy what they have to say. As is my tradition, I want to start tonight with our data slide. So if you'll allow me to share my screen. Okay, 4 slides tonight. First is our hospitalized patient numbers. You can see that the trend is very good here. However, we still have well too many patients in our local hospitals. You'll also note that the ICU numbers have not really changed. They hover between the mid 80s and the upper 90s. Here's our case count positives. So this would be new cases over the last 14 days by age group. Although the leaders here are the 30 to 39 age group and the 18 to 25, I think it's safe to say between 18 and 69, there's quite a bit of COVID spread in the community. Now, we've been showing you this slide for several weeks. It shows the remaining hospital beds at the end of the day. So open beds in green, patients holding in blue, and then the remaining hospital beds in yellow. We've had a bit of good news the last 2 days with beds available. That's positive. And finally, the state hospitalization rate. This looks not only at Lubbock, but the entire region that we are in, the travel service area that we're in. You can see the 15% metric, which is what the state has indicated is that point where our hospitals become stressed. We still operate well above that. Today's number went down below 25% for the first time in a month. However, we still have much work to do. Okay, I'm back. So just a few quick comments. First of all, I think there is some improvement. However, we cannot rest now. The vaccine has arrived to our community this week. Our frontline healthcare workers are being immunized. We're far from out of trouble, out of the danger zone. I want to express empathy. There have been many families and businesses that have been impacted in the last 9+ months. Loved ones have been lost. Our good friend, Judge Ruben Reyes, passed away over the weekend. We know that wearing face masks, keeping a social distance, really, frankly, observing personal responsibility, that's how we control the spread. We're going to make decisions based on facts, not fear. We encourage all of you to stay safe, to be kind, and to be hopeful. I'm going to introduce our guests tonight and I'm going to read a quick bio on all of them, and then we'll start with Dr. Cook. Now, many of you have been seeing Dr. Cook now for 9 months. He's our public health authority. He's been in healthcare for nearly 40 years and has served as the City of Lubbock Public Health Authority for the last 9 years. In that role, he coordinates with the City of Lubbock leadership and our public health department to coordinate our response to, in this case, COVID-19. Tonight, we'll also be joined by Dr. Dennis Duriet. Dr. Duriet is an infectious disease physician. He's practiced medicine for 33 years, 31 of those in Lubbock at Covenant Health. We'll also be joined by Dawn Robinson. Ms. Robinson is the Director of Respiratory Care Services at Covenant Medical Center. She's been in healthcare for 27 years. Her role with COVID, the COVID response, includes staffing, overseeing the distribution of respiratory supplies and equipment for the entire region. She also assists infection control with COVID discussions on patients and caregiver safety as it relates to the pandemic. We also tonight will be joined by Jessica Wolfe. Ms. Wolfe is the Director of Nursing Medical Surgical Intermediate Critical Care at UMC. She's been in healthcare for 16 years. Ms. Wolfe provides 24-hour direct leadership and supervision of COVID-19 Intermediate Critical Care Department and collaborates with the UMC COVID-19 Strategic Planning Committee. Finally, tonight, we will be joined by Dr. Ebtesam Islam. Dr. Islam is an assistant professor in the Department of Internal Medicine, and specifically in the Division of Pulmonary and Critical Care at the Texas Tech University Health Science Center. She also has a PhD and is a researcher. She has been at Texas Tech University Health Science Center since November of 2016. She is on the front line of what's going on. To begin tonight, please let me call on Dr. Ron Cook. Ron?
Thank you, Mayor. I appreciate that so much. I want to convey our excitement that we have the vaccine here in Lubbock. University Medical Center receives theirs tomorrow. I'm supposed to get my vaccine as a frontline worker on Friday, and Covenant has already received their vaccine and is inoculating those individuals that are on the front line in their institution. When this pandemic started, the public health department had two main goals. Those two goals were initially to slow the spread, and that's when we talked about flattening that curve, and that's when we talked about wearing a mask and physically distancing and washing our hands and staying in small groups. That's how we initially slowed this spread. Our second goal in public health is to eliminate and eradicate this virus. And the way that we do that is to get vaccinated. I just read an article this afternoon from the New England Journal of Medicine that says it looked at almost 50,000 participants in that vaccine trial, the Pfizer vaccine trial, and that included patients of the age 16 and older. It found that this vaccine is 95% effective. The vaccine is safe, and most individuals only had mild to moderate reactions to the injection. Pain at the injection site, some muscle aches and pains, some fevers, those sorts of things, but they were short-lived. And so this is a safe vaccine from what we know so far. Our goal is to return our community back to normal. And the two ways we do that is to continue our social distancing and facial coverings and hand washing, and most importantly now, is to get your vaccine when it's appropriately timed for you. As we get more vaccine, as you probably have heard, it goes in phases. We're going to do our frontline people first. We're going to do our long-term care facilities. We're going to do our EMS and police, those sorts of people that are on the front line. And then it's going to be, as it rolls out, we have community partners, not only in some of your own physicians' offices, but also in our pharmacies that are our community partners that give out this vaccine as well, at no cost to you. The other goals to get back to normal, and the other goals of this vaccine are to decrease death and serious disease, because we know this disease is not like any other disease that we've seen in the past, any other virus, that it goes on and on and on forever. And it makes so many people acutely ill. And should they get out of the hospital, sometimes that road to recovery is weeks, if not months long. The other goal of this vaccine is to preserve the functioning of our society, of our community, to get back to normal, to open our businesses again, to open our restaurants, for people to get back to work and earn an income. The last goal of this vaccine is to reduce the burden of COVID-19 on those individuals that are already facing disparities and all the new people that have now facing those disparities because they're out of a job, because they're not able to make rent, not able to make their house payment, not able to pay their utility bills, and it's been cold outside, not able to put food on their table, not able to get their children back in school in an in-person classroom setting. The sooner that we get everybody vaccinated, the sooner that we can return to normal. This is exciting news for us. It's going to take time to roll out this vaccine, but it will come, and we're having more doses on their way. I want to remind you that if you have tested positive within the last 5 days and you are in that high risk group, you're greater than age 65 in most cases, you have comorbid conditions like hypertension, heart disease, lung disease, obesity, those sorts of immune deficiency syndromes, you will qualify for a free infusion of those antibody drugs like bamlanivimab and Regeneron. Those are currently available right now at UMC and at Covenant. If you qualify, please talk to your primary care provider, your primary care physician, and ask them to refer you to the infusion process. The goal there is to keep you out of the hospital, especially if you're high risk. Lastly, until we get everybody vaccinated, we've got to hit about 80% before we get to herd immunity. The last thing we cannot stop is we must continue to wear a mask, physically distance, but stay socially engaged. Wash your hands, stay in small groups. Christmas must be much like our Thanksgiving where we have small groups, and then get vaccinated when it's your turn. That's all that I have. Let me hand this off to Dr. Dennis Duriet, the infectious disease expert over at Covenant Health Systems. Dr. Duriet?
Thank you, Dr. Cook. As you heard, I'm Dennis Duriet. I'm the infectious disease practitioner at Covenant Medical Center. Until now, our efforts to fight this virus are centered around two main points. First, mitigation, such as social distancing and masking. Everyone's aware of that. The other is therapeutics. As Dr. Cook pointed out, things like remdesivir, monoclonal antibodies, and even plasma in the fact. In the past, these efforts have had a modest result at best. However, things are changing because now we have a new tool that may prove to be a game changer. A new COVID vaccine has arrived in Lubbock, and it may prove to be the first step towards normalcy. However, it can only do so if people take it. I cannot emphasize this point enough. As a frontline worker of COVID patients on a daily basis, I was included in the first group to be vaccinated in Lubbock. I received the vaccine yesterday, and I'm happy to say I haven't had any reactions or bad side effects. In the near future, we will expand vaccine access to the community, starting with the rest of the first responders and the susceptible people in our community. As Dr. Cook pointed out, experts estimate that between 70 and 80% of our local population needs to be immune to the virus before we can eradicate it. This is the quickest way to achieve this goal, and is through vaccination. Therefore, it is crucial that everyone do their part. In terms of the vaccine itself, it is an mRNA vaccine. mRNA is a small piece of genetic material that codes for the production of a very small piece of virus. It is important to know that this little piece of virus is not infectious and does not give you COVID. However, it does trick the body into believing it has become infected, and it forms antibodies. Later on, when you're exposed to the real virus, those antibodies attack the virus, neutralize it, and prevent infection. I would like to address several misconceptions that seem to be making the rounds around town. As I already explained, the vaccine will not give you COVID. People who are vaccinated will not test positive for COVID. The COVID tests look for viral RNA. Yes, that's true, but it's not mRNA. Therefore, a person will not test positive and it will not have trouble going to work or interacting with other people. The vaccine will not make females infertile. We have not seen any evidence of this in previous clinical trials. The vaccine does not act as a GPS tracker that would allow the government to track your movements. The mRNA does not cross into the nucleus of the cell where a person's DNA is stored. Therefore, it will not induce mutations in people. Once the vaccine is available to you, after consulting with your physician, I encourage you to get the vaccine. It really is the quickest way to return back to our normal lives. And with that, I would like to turn things over to Don Robinson.
Good evening. Thank you, Dr. Duriet. Appreciate that. And thank you, Mr. Mayor and the rest of the City Council for allowing me this opportunity this evening. I wanted to be able to come and talk to you guys today about the role of the respiratory therapist in the care of the COVID patient. And chances are many of you have never even met a respiratory therapist or even have any idea what kind of healthcare professional they might be. Basically, we're specialized healthcare practitioners trained in critical care and cardiopulmonary medicine to help people suffering from acute critical conditions, cardiac and pulmonary diseases. People mostly know us for taking care of COPD patients or asthma patients or traumas when they come in. We work in every area of healthcare. We dedicate 2 full years of our training just to learn how to help people with lung dysfunction. And we focus primarily on the lungs, the brain, the heart, and the kidneys. So as you know, COVID can affect many different organs in your body, but it especially loves to attack your lungs. And so that's where the respiratory therapist comes in. So I would ask you a question in the community. Do you ever stop and think about breathing? Do you have to really consciously make an effort to think about breathing? Not really, because your body basically is automatic. And it's something that we all take for granted, and we never have to worry about getting our next breath. But I'll tell you, our COVID patients are fighting a much more serious battle. And when it comes to breathing, and respiratory therapists are going to be right there, right beside the physician, right beside the nurses, trying to help these patients. We have many interventions that we use, from oxygen, high flow oxygen, non-invasive ventilation such as BiPAP, and of course the ventilator, which a lot of people like to call a breathing machine. So I want to share a little story with you, and I want to give you a glimpse into what it's like to be a COVID patient that is struggling to catch their breath. Shortness of breath racks their entire being. Imagine not being able to catch your breath, or breathing so fast that you think it will help you, but it never does. You start to panic. It sets in, and you start to get into a fight or flight mode. You get restless and nervous, and then your breathing gets even more difficult. Your physician may order medications to help calm you down. The RT is going to hold your hand, and they're going to reassure you that it's going to be okay if you can just listen to their coaching and focus on your breathing. But COVID is continuing to lurk in the background all the time, ravaging your lungs. Eventually, you get so tired, you feel like you can no longer go on with our interventions, such as high flow oxygen or BiPAP. You have to make a choice. You have to talk to your doctor and your family, and you have to make decisions. And you may decide that you want to be on a ventilator or a breathing machine. You might get a little relief once we get the tube in your throat and we medicate you so that you're not awake while we perform this procedure. But then we, as the healthcare providers at the bedside, start trying to figure out how to manage what you need to take care of your lungs. So your lungs are filling with fluid and you can't exchange oxygen like we require to live. We try everything. We reflect on our training, we reflect on our expertise, but it's no match for COVID because COVID fights harder. And as caregivers, we feel like we're failing our patients. We've lost many patients to this disease, and every single death hurts us to the core. And we know that this is not the way people are supposed to die. In an ICU, on a ventilator, with no loved ones there. This pandemic has taken quite a toll on the bedside caregivers, mentally and physically. There's a daily struggle to get out of bed and continue to come work and fight for these patients. But that's what we do as healthcare workers. We live our mission and we love our patients. So all I can ask you from the healthcare side is please follow social distancing. Please wear your mask. If you have the opportunity to get your vaccine, please get it, because we're tired and we're ready for this to be done so we can get back to our normal lives. So thank you very much for having me, and I'd like to introduce Dr. Ebtisam Islam.
Thank you, Ms. Robinson. Kind of what Ms. Robinson talked about. So I am one of the medical ICU intensive care physicians, and I've been taking care of COVID patients since March of this year. And so we've been doing this for about 9-10 months that we've been taking care of these patients. And as Ms. Robinson talked about, the breathing machine or the ventilator, this is predominantly the type of patients that we have in the intensive care unit. So our medical ICU at UMC alone is 33 beds, and imagine that ICU is completely full, all with intubated patients, and we've had to open up other ICUs in order to accommodate more vented patients or patients requiring high flow oxygen. And the one thing that always surprises me when I'm rounding in my medical ICU is how young my patient population actually is. I have had patients in their late 20s, their 30s, their 40s, come to my ICU, get intubated, and a lot of them unfortunately don't make it. And I think what people need to understand is that COVID doesn't discriminate. COVID will go after anybody. The problem is we don't know who's going to recover from it. And I think that's where the real issue is and the concern. We keep talking about this number of 1% of mortality death rates that we're only seeing. But I think it's important for people in the community to remember that that 1% is 100% to those family members that have actually lost somebody. And I've had family members who their only reasoning is, but they're too young to die of COVID. And I have no good answers for that, other than that's what COVID is, unfortunately. I definitely consider Lubbock my community. This is my family. I was raised here. I went to school here. And so anybody who comes to my medical ICU, I know myself and the staff, that we treat those patients like they're our family members. And you put 100% effort every day, no matter how tired, no matter what is going on, you put 100% for every patient. And so what I would like to ask of the community as my family is to take care and to protect your frontline healthcare workers, because we are all family here, we're all community, and I love this community and I know they can do some amazing things. The other part is I think everybody has COVID fatigue, not just the community. We're all sick of this. We are all done with this and we want it to be over more than you know. So everybody has COVID fatigue around here. The community is not the only one. The healthcare workers are definitely having COVID fatigue. Thank you so much for taking the time to listen to me. And with that, I would like to introduce Ms. Jessica Wolfe, who's the Director of Nursing for Medical Surgical Intermediate Critical Care.
Go ahead, Jessica. I think you're live.
Good evening. Thank you for this opportunity. One message I want to echo, much of that, as Ms. Robinson and Dr. Islam have stated, is as healthcare providers, we continue to be firm and fearless in our fight, but I think just as any warrior would be, we're starting to grow weary. I'll have the opportunity, and I'm grateful and humbled to speak on behalf of the professional nurses that serve the Lubbock community, but I'll focus on bedside clinicians, and I certainly don't want to credit or discredit the thousands of individuals that support our frontline staff. I have the unique front seat and opportunity to lead some of the strongest, experienced, and vigilant nurses in our community. Every day as a leader, I watch the fatigue and burnout continue to set in as this pandemic continues to plague our communities, and yet our staff continue to show up day after day. Your frontline caregivers in your community are emotionally and spiritually torn. We've watched countless times COVID-19 rip through families, neighbors, and friends. As professional nurses, we seek to ease suffering. And prior to COVID, we had the ability to celebrate the many successes of our patients improving, but today that's not the case. We continually to prepare ourselves draped in protective apparel to provide medical intervention, compassion, comfort, and presence to our patients. If I could just ask the community to just take a minute to imagine the only visitor to your room while you're scared, you're tired, and combating COVID being a healthcare worker. I myself have cried with patients, families, and my staff as we've assisted in families sharing their final goodbyes via an iPad. I watched teenagers a couple weeks ago say goodbye to their mom. I've continued to watch families exit rooms knowing that this is the last time that they'll ever be in the comforts of their loved ones. The true roller coaster we are on is filled with so many more downward turns than the ups lately. I, as a professional nurse and a leader, am genuinely concerned for our community and the welfare of our healthcare providers, as we often feel defeated and lost. COVID has created a tornado effect, not just within our community and the walls within the healthcare that we serve, but has meant the loss of so many lives that are important to others, and will have a lasting impact on the patients who have overcome the illness in some shape or form, and those that you call the heroes within our walls. I can assure you that your heroes are crying, they're worried, and they're constantly living in this current climate, hoping and praying that one day we can return to what we remember as our normal. Our normal being when we were able to serve you and your loved ones at the bedside with visible smiles intact and the ability to touch you without having to wear double gloves, and where your families were there to cheer you on. And so I think that's the message I just want to echo, to ensure that the community is really knowing what's going on at the hospitals here and within your Lubbock community. Thank you, and I'll return this back to the panelists.
Okay, thank you so much, Ms. Wolfe. If I could ask all of our panelists to come back. So let's have a little roundtable discussion. One thing that I'm so conscious of today is, I've bragged about healthcare in our community for most all my adult life. And in the last 9 months, I've got to watch it right up close. I'm so thankful for the men and women who, like the ones that join me today, but who take care of our community and our region. Dr. Duriet, I'd like to start with you. You're an infectious disease physician by training. And what surprised you the most about this pandemic and where we are today? What have you learned since we first started hearing about this in January or February?
Well, I would like to echo what Dr. Cook said in his beginning statements, in that it is amazing how persistent and resilient this disease has proven itself to be. We have thrown different measures, the experimental drugs, and nothing seems to have made a significant impact. My only reference is the 1918 flu pandemic. You know, obviously it had a very devastating impact on society, not only here in the United States, but also around the world. And I always thought that if we applied today's therapeutics, medical knowledge, and access to medical care to the situation in 1918, things would be different. Now, move forward 102 years, and granted, it's a different virus, but with all those advantages, the virus still ate our lunch, for lack of a better term, you know. And I think that it's something that we need to consider, because that's not supposed to happen in the United States. You know, we're supposed to be better than this. You know, I think eventually we're going to get through this. God willing, the vaccine will help us get through this. But when we do, we cannot become complacent. We have to take the necessary measures and steps to ensure that 100 years from now, our grandchildren and our great-grandchildren don't have to go through what we're going through right now.
Thank you, Dr. Duriet. That's really a great response. I want to pose a question to both Ms. Robinson and Ms. Wolfe. Same question. You guys manage and lead, Dawn, in your case, respiratory therapists, Jessica, in your case, nurses. What have you seen what have you learned about about our healthcare workers, specifically the ones that work for you? And you might share a story with us. Dawn, let's start with you. But what have you seen? And I know you shared a little bit earlier, and you both did so well. But I want you to drill a little bit deeper.
I would say that resiliency is a really strong word that I could use for our staff. They have overcome a lot to figure out how to try to treat these patients. I sat down a more senior RT about a week ago, and then I sat down maybe one of my newer graduate RTs, and I said, what's the deal here? What's going on? Tell me how this is working and affecting you. And they both told me, the senior RTs, like, it's just everything I know and all the traditional things that we do to take care of patients with lung problems are not working. Everything we tried is just failing, and it's frustrating. And then you talk to my new graduate respiratory therapist, who's amazing, and she's like, well, this is all I know. I haven't seen any other type of patient. When I came into this, COVID was full blast. So she had to learn and adapt and use the limited skills she had to learn how to take care of these patients. And we've all come together as a department sometimes and just talked about what are some creative ways we can learn to figure out how to take care of these patients. I think they've been very resilient. I think they've tried very hard to do their very best to save as many patients as they can.
Thank you. Jessica?
I'd have to agree. I think our healthcare providers here when faced with adversity, are resilient. They've shown grit, continue to show and try to excel in ensuring that they're giving compassionate, connected care. We are faced with challenges with trying to decrease the time that we're spending in the patient's room so that we don't increase the spread of transmission. And so we really focus on trying to bundle care. The staff, they're wearing Tyvek suits, they're covered in an N95. I mean, everyone's seen the images, the bruising, the in lines of indoors, and they'll spend hours with patients. And sometimes when we've decided to go the comfort route with patients, they spend hours there at the bedside, holding their hand, making sure that they're comfortable. And so I've learned that they're a resilient group. When faced with adversity, they kind of make it their personal mission to conquer this crusade. I've also learned that they're human, and they feel this in every possible bone and nerve. And I guarantee you there's not one nurse out there who hasn't left and gone and sat in their car for about 10 to 15 minutes and just cried the day away before they go home and try to go home to their loved ones and their children and their family. I'm speaking from my personal perspective as well, where we try not to take that home because it just lives in the hearts and minds of what we're facing right now. And I've learned that we take care of our own. You know, our nurses have been so flexible and accommodating. You have nurses who have been phased to different cares of the hospital in order to manage the capacity, both COVID and non-COVID. You have nurses serving in a medical tent. Who would have thought, you know, that we would have to set up a tent in our community to put patients in? And so I'm very happy to serve the role that I serve in this profession, and very humbled to see how everyone has stepped up and is there ready to rock and roll and make this a thing of our past.
Thank you so much. Thanks both of you. So Dr. Islam, what can the community do to help? I mean, this is your hometown. You made that clear a while ago. You grew up here, you trained here. Well, what can we do to help?
Well, I mean, we can start with the basics that everyone already knows. Obviously, wear your mask, even if you get your vaccine, wear your mask, social distance, you know, wash your hands. But I think kind of talking along the lines of kind of for the healthcare workers, ask about them. If you know somebody who's a healthcare worker, ask them, how are you doing? How was your day? What can I do for you? You know, and I think sometimes when you don't feel like it's just, you know, the burden is just on you and someone's kind of taking that burden away from you by asking you about it, I think sometimes that doesn't do 100% relief, but it helps a little bit in the sense of someone else cares who's not a healthcare worker about how I'm doing in this kind of environment.
Yeah, thanks. That's a really good perspective. Okay, so I'm going to pose the same question to all of you guys, and I'm going to sort of go backwards. I'm going to start with Jessica and work my way backwards in the order we used earlier. But Jessica, what message would you most like to share with the people of Lubbock and the South Plains region?
I think the message I would like to share is really if you could see what's going on through a nursing lens, through a healthcare provider lens, and before you decide not to put a mask on, wash your hands, socially distance, and modify our upcoming holiday celebrations, I encourage you to ask each other, how valuable are the lives that you have in your circle, and how valuable they are to ensure that they stay in your circle. And what would you do to make sure they're safe? And how far would you go to do so? That's what I think I'd want to add question.
Okay. Dr. Islam, same question. What would you most like to share with our community?
What I'd most like to share is what I have found since this has started is that people are inherently good and this community is phenomenal. When we first started out, engineering from Texas Tech University and other faculty members from the Health Science Center all got together and they formed the West Texas 3D Consortium, and they were making shields and they were testing masks, and now they're making ventilators, and they have made ventilator stands for our monitors. And this was always the highlight of my day when I was in the COVID unit, because it was just so uplifting. It was so hopeful. And people from the Honors College, Dr. Aliza Wong, Dr. Al Sacco, phenomenal group. And I mean, they're a huge group. And just the fact that they couldn't be there to help us on the front lines, but the fact that they put their brains together and they did whatever they could. So this community is phenomenal. And I think people are just inherently good and they want to help. And I really appreciate that.
Wow, that's fantastic. I should have asked that. You should have been very last. You could have been the anchor. We could have closed after that. Dawn, same question. What would you most like to share with the people of Lubbock?
I probably could echo both of what Jessica says and what Dr. Islam says, but I think one of the things that I would like to say is that I really appreciate the community. I think that we've had so much support from the community. Early on, we were so worried about PPE. We had little ladies sewing masks and donating them, and people making face shields. We had a lot of caregivers who weren't doing direct patient care. We set up this big conference room, and we got so innovative and tried to figure out how to make our own PPE if that's what we had to do. But the community and everything that they've done for us, even the restaurants that were closed that donated food to the departments, and the well wishes. And you know, one of the most recent things that we got that made the most impact on several of my caregivers was the Junior League of Lubbock. They came and they got chalk, and they were just writing all these encouraging things where the employees walk in and out. And it made such a big difference that even some of my therapists stopped and cried because somebody cared. So I would just say so much. Our community is amazing.
Yeah, thanks, Don. It is amazing. Dr. Duriet, what would be your message to our community?
Well, first of all, I want to congratulate all my fellow panelists. They have made some incredible points, and they have answered questions beautifully. As a physician, I'm going to take a different tack and say, okay, one of the things that we can do is, besides the obvious things about being considerate with one another, wearing a mask, and looking out for one another, is the other thing that you can do is vaccinate yourself. You know, go out and take the vaccine once it becomes available. I've been doing this for 9 months, and I'm telling you, this is the only way I see out of this. You know, and another thing to consider is that during this season, influenza is right around the corner. So I encourage people to also get the influenza vaccine, because the last thing you want is to get COVID and influenza, and that is going to happen.
Thank you, Doctor. I want to pause and thank Dr. Ron Cook for helping put together this effort tonight. Ron, you've been sitting and listening. I'm going to pose that same question to you. I was going to ask you about the pandemic of 1918, but since we're about the same age, I decided that probably wouldn't be appropriate to do that. But no, seriously, Ron, what have you learned, and what would you like to share with our community?
Thank you so much. You know, just echo what everybody else has said. We have a fantastic community. We learned how the entire community came together and worked together, from businesses and universities and even people from out of town. We had big industries sending us plastic to make face shields. And you know, all it took was a few phone calls, and people were wanting to help in any way possible. That's just fantastic to see our community come together like that. The other thing is, we're not out of the woods yet. I want to make sure that everybody knows that we're not out of the woods. We have some work to do. We have good news that the vaccine is here, and we are giving it out as fast as we can get it in. So there are impatient people. I know it's coming, and we're going to get it. So just hang on. In the meantime, we got to continue doing all those other things that mitigate the virus. That's the social distancing and that sort of thing. The last thing I want to say is, please check on people you love and care about. And for those that you don't even know, ask them how they're doing. There will be significant post-traumatic stress disease after this is all over. We're already seeing it now. What's happening is people are putting it off and just going back to work so they don't have to deal with it when they're alone. So reach out to your loved ones, reach out to the people that you care about, reach out. And it's not just healthcare workers, it's business owners, it's other entities that have been affected by this. It's individuals who've lost their job. Reach out and make sure your loved ones, your neighbors are all okay. And if they're not, please do something for them. Have them call their primary care provider. And if you don't have a primary care provider, we have ways for you to do that. So please reach out to us and reach out to your loved ones to make sure that they're all okay.
Thank you, Dr. Cook. So we have just a few minutes left. I thought we might give everybody a chance to share, if they wanted to, to share a story. Some of you have told little vignettes, but if you've got a story from the pandemic that you would like to share that you think might be impactful, I'll start. This afternoon, I had a chance to visit the spouse of a friend of mine who passed away of COVID. And she said, we never thought that he wouldn't come back home. We thought he would be home a week or two ago. We thought it might be a Christmas present for us when he came home. But her message to me really hit home as I listened to her as she grieved and explained the loss that she and her family are feeling over losing her husband and her kid's father. Where do we want to go? Jessica, you shared a story or two the other day when we talked. Would you like to start?
Sure. I think in the midst of some of the challenges that we have and a lot of the sadness that we have to remember, and we do a good job of celebrating the wins. You know, I think both organizations are doing a celebration overhead when a COVID patient finally goes home. And when I say they finally go home, I mean after living in the facility for 32 plus more days. And so we really try to honor that moment because we don't see a lot get discharged and get to go home to their families and celebrate with their wives and children or their extended family. And so for us, you know, I was really joyous to see last week I got a video sent to me from my staff of them lining up in the hallway and doing kind of YMCA for a patient getting to leave, and the patient being a great sport because he was so excited to go home and, you know, made sure he had a special shirt on to go home. And, you know, the reuniting of the family, even from the downstairs, loading him up in the car and being able to call on him the next day and follow up and make sure that he's doing okay after spending 32 days with us, knowing that he's on the path to recovery with ailments still, gives us hope as healthcare providers that what we do, what we strive to do every single day, it does and can work. And so I think, you know, outside of the loss that we've all experienced, we really try to hold on to those stories that allow us to celebrate some small wins.
Thanks. Great story. Thank you. Dr. Duriet, you have any specific story you'd like to share?
My story also is one of loss, and it nearly brought me to tears. Taking care of a fellow physician who had been a pillar in this community for years. And unfortunately, he became infected when he ran into a COVID patient's room to resuscitate the patient without the appropriate PPE, because at that moment, he did not value his life over the other person's life. It was more important as a physician, it was more important to help his patient than to take care of himself. And he ended up dying.
Mm.
Dr. Islam, you want to share?
Yes, thank you, Mayor Pope. What I have been surprised by kind of recently, just because we're just now seeing long-term effects of COVID, are people approaching me in the hospital for appointments because they didn't get hospitalized, they stayed home in quarantine, but they are still feeling long-term effects of COVID. They're still having myalgias, muscle aches, they're still having fatigue, they're still having shortness of breath. And so now I worry about, and it really took me by surprise because these people are not going to the hospital. They didn't need oxygen. They just quarantined at home. And so it's just, you know, be cautious. Just because you're not in the hospital doesn't mean you can't have long-term effects of COVID and memory loss. I've also seen memory loss. And so just kind of be wary of that. Just because you're not in the hospital doesn't mean you can't see the other effects of COVID on you later on. And please reach out to your physicians for help with that.
Yeah, good message. Thank you. Dawn, how about you?
Kind of echoing a little bit of Dr. Islam, what we're seeing is, so respiratory therapists, we also do pulmonary function testing. And we're seeing some pulmonary function testing now on some patients that we've actually done pre-testing before they got COVID, and now we're doing some post-testing, and we're seeing significant lung damage. We're seeing more fibrotic lung disease. So the long-term effects of maybe COVID and how it's attacking the lungs is going to start affecting morbidity as we move forward. And we're going to start seeing a lot, I fear, a lot more long-term effects, like Dr. Islam says. And I work with a group of clinical institutes out of our healthcare system. And a lot of the meetings we talk about, you know, what's recovery look like? How's it going to be long term? In the next 5 to 10 years, what are we going to see our population facing? And how's healthcare going to be responding to that? So, and then to reflect on Dr. Duriet's comments about our physician friend, we've also lost actually our own healthcare workers that have worked the bedside. We've lost people in our facility that clean the rooms. So it's affected us as a family as well, and it hurts in our facility.
Thank you. I know that our community joins me in thanking you guys for, first of all, sharing with us tonight, but more importantly, for what you do every day and have done every day, not just for the last 9 months, but for many, many, many years in our community. So on behalf of Lubbock and the South Plains, let me just offer heartfelt gratitude. Thank you for what you do. I want to remind everybody that if you'd like to participate on Friday evening at 6 o'clock, we're going to assemble at the Civic Center in the parking lot for a car parade. We're calling it the Drive of Good Cheer. Now, you're not going to get out of your car. It's going to be safe. We'll line you up. We'll be led by, I think, the Mary St. Nick will be coming in from the North Pole to lead us on, and we're going to drive by our healthcare institutions and just honor our healthcare workers. Decorate your car, you can listen to Christmas music. It's not going to be a long parade, but we think it's a great opportunity to do safely for us to honor healthcare workers and to celebrate the season. We won't come back to the Civic Center. The parade will end at the 34th at Avenue Q. You can go about your evening. Maybe you can go watch go see some Christmas lights that night. But I want to thank all of you for joining us tonight. I wish you all a very safe holiday season and a very Merry Christmas. Good night.